Question 1. A client is admitted with suspected sepsis. Which immediate nursing actions are appropriate to prioritize? Select all that apply. A. Administer broad-spectrum antibiotics as prescribed. B. Obtain blood cultures before antibiotic administration. C. Insert an indwelling urinary catheter for strict intake and output. D. Initiate aggressive fluid resuscitation with 4 crystalloids. E. Prepare the client for immediate transfer to the intensive care unit. F. Administer acetaminophen for fever greater than 101, 5 degree F, 38, 6 degree C. Answer. Administer broad-spectrum antibiotics as prescribed, obtain blood cultures before antibiotic administration, initiate aggressive fluid resuscitation with 4 crystalloids. This question tests prioritization of interventions for a client with suspected sepsis, a life-threatening condition. Key clues are suspected sepsis and immediate nursing actions, indicating a need for rapid intervention. Administering broad-spectrum antibiotics and initiating aggressive fluid resuscitation are critical to counteract the infection and improve perfusion, while obtaining blood cultures before antibiotics ensures accurate identification of the causative organism. Inserting a urinary catheter or preparing for ICU transfer might be necessary but are not the immediate, life-saving priorities, and administering acetaminophen alone does not address the underlying systemic infection. For example, delaying antibiotics even by an hour can significantly increase mortality in septic shock. Always remember, cultures first, then fluids and antibiotics stat. Question 2. The nurse is educating a client newly diagnosed with type 1 diabetes about insulin administration. Which statements indicate effective learning? Select all that apply. A. I will rotate injection sites within the same general area, like my abdomen. B. I should always refrigerate my open insulin vials to keep them effective. C. I will draw up my NPH insulin first, then my regular insulin. D. If I miss a meal, I should still take my insulin as usual. E. I can recap the needle after injection to prevent accidental sticks. F. I will check my blood sugar before each meal and at bedtime. Answer. I will rotate injection sites within the same general area, like my abdomen. I will check my blood sugar before each meal and at bedtime. This question assesses a client's understanding of safe and effective insulin administration practices. The phrase effective learning indicates the nurse is looking for correct statements. Rotating injection sites within the same area, e.g., abdomen, helps maintain consistent absorption rates and prevents lipodystrophy, while regular blood glucose monitoring is crucial for dose adjustment and preventing hyperglycemia or hypoglycemia. Open insulin vials can be kept at room temperature for up to 28 days. NPH should be drawn after regular insulin. Missing a meal usually means adjusting insulin dose, and recapping needles is unsafe practice. For instance, injecting in the same spot repeatedly can cause hardened tissue, making future injections less effective. Always prioritize consistent absorption and vigilant monitoring. Question 3. A nurse is caring for a client with a new prescription for warfarin. Which statements indicate adequate client understanding regarding this medication? Select all that apply. A. I should use an electric razor instead of a straight razor. B. I will try to eat a consistent amount of green leafy vegetables daily. C. I need to report any unusual bruising or bleeding to my doctor. D. I can take ibuprofen for headaches while on this medication. E. I should get my INR checked regularly as directed by my doctor. F. I will stop taking the medication if I feel lightheaded or dizzy. Answer. I should use an electric razor instead of a straight razor. I will try to eat a consistent amount of green leafy vegetables daily. I need to report any unusual bruising or bleeding to my doctor. I should get my INR checked regularly as directed by my doctor. This question evaluates a client's understanding of important safety precautions and monitoring for warfarin, an anticoagulant. The keywords adequate client understanding require selecting all correct safety measures. Using an electric razor, maintaining a consistent intake of vitamin K-rich foods, green leafy vegetables, reporting signs of bleeding, and adhering to regular INR monitoring are all crucial to prevent complications and ensure therapeutic efficacy. Taking ibuprofen, an NSA day, is contraindicated due to increased bleeding risk, and abruptly stopping warfarin can lead to dangerous clot formation. For example, a client who maintains a steady intake of spinach avoids sudden fluctuations in INR, reducing bleeding or clotting risks. Remember that consistency and vigilance are key with anticoagulants. Question 4. The nurse is preparing to administer medications through a nasogastric tube to a client. Which actions are essential before administering the medications? Select all that apply. A. Crush all medications into a fine powder. B. Verify tube placement by checking the pH of aspirated gastric contents. C. Aspirate stomach contents to check for residual volume. D. Flush the tube with 15 to 30 milliliters of water before and after each medication. E. Administer medications separately, flushing between each. F. Elevate the head of the bed to at least 30 to 45 degrees. Answer. Verify tube placement by checking the pH of aspirated gastric contents. Aspirate stomach contents to check for residual volume. Flush the tube with 15 to 30 milliliters of water before and after each medication. Administer medications separately, flushing between each. Elevate the head of the bed to at least 30 to 45 degrees. This question focuses on safe medication administration via a nasogastric tube. The word essential highlights the critical steps to prevent complications. Verifying tube placement, e.g., pH check, checking residual volume, flushing before and after, administering medications individually with flushes in between, and elevating the head of the bed are all vital for client safety, preventing aspiration, and ensuring medication delivery. Not all medications can be crushed, as some are extended release or enteric-coated and would lose their efficacy or cause toxicity. For instance, administering medications with the head of the bed flat significantly increases the risk of aspiration pneumonia. Always confirm placement and elevation to prioritize safety. Question 5. A nurse is caring for a client who is experiencing an acute asthma exacerbation. Which assessment findings would the nurse expect? Select all that apply. A. Bradypnea. B. Expiratory wheezing. C. Increased forced expiratory volume, FEV1. D. Use of accessory muscles for breathing. E. Prolonged expiratory phase. F. Dyspnea and cough. Answer. Expiratory wheezing, use of accessory muscles for breathing, prolonged expiratory phase, dyspnea and cough. This question assesses the nurse's knowledge of the clinical manifestations of an acute asthma exacerbation. The key phrase acute asthma exacerbation directs the nurse to recognize the hallmark signs of airway constriction and inflammation. Expiratory wheezing, use of accessory muscles, a prolonged expiratory phase, dyspnea, and a persistent cough are all classic indicators of compromised airflow. Bradypnea, slow breathing, is generally not seen. Tachypnea is more common unless the client is severely fatigued, and FEV1 would be decreased, not increased, due to bronchoconstriction. For example, hearing a high-pitched whistling sound as the client breathes out confirms the narrowing of the airways. Always think tight airways when considering asthma symptoms. Question 6. The nurse is caring for a client who underwent a total hip arthroplasty. Which interventions are appropriate to prevent postoperative complications? Select all that apply. A. Encourage early ambulation with assistance. B. Maintain hip abduction with an abductor pillow. C. Instruct the client to cross legs at the ankles while sitting. D. Ensure the client avoids hip flexion beyond 90 degrees. E. Administer prescribed prophylactic antibiotics. F. Apply anti-embolism stockings. Answer. Encourage early ambulation with assistance. Maintain hip abduction with an abductor pillow. Ensure the client avoids hip flexion beyond 90 degrees. Administer prescribed prophylactic antibiotics. Apply anti-embolism stockings. This question tests knowledge of postoperative care for total hip arthroplasty, focusing on complication prevention. The words appropriate and prevent postoperative complications direct the nurse to select interventions that address common risks like dislocation, DVT, and infection. Early ambulation, maintaining hip abduction, avoiding hip flexion beyond 90 degrees, administering prophylactic antibiotics, and applying anti-embolism stockings are all crucial to prevent dislocation, deep vein thrombosis, DVT, and infection. Crossing the legs at the ankles is contraindicated as it promotes hip adduction, which can lead to dislocation. For instance, using an abductor pillow keeps the client's legs apart, preventing the ball of the new hip joint from popping out of the socket. Always prioritize proper alignment and prophylactic measures after hip surgery. Question 7. A nurse is providing discharge teaching for a client with heart failure. Which statements should the nurse include in the teaching plan? Select all that apply. A. Weigh yourself daily and report a gain of 2 to 3 pounds in a day. B. Limit your sodium intake to 2 grams per day. C. Engage in moderate intensity exercise for 30 minutes, 5 times a week. D. Report any new or worsening shortness of breath to your provider. E. You should get a flu shot annually. F. Increase your fluid intake to at least 3 liters per day. Answer. Weigh yourself daily and report a gain of 2 to 3 pounds in a day. Limit your sodium intake to 2 grams per day. Report any new or worsening shortness of breath to your provider. You should get a flu shot annually. This question assesses understanding of essential discharge teaching for a client with heart failure. The phrase, should the nurse include, emphasizes selecting key self-management strategies. Daily weighing and reporting significant gains, indicating fluid retention, limiting sodium intake, reporting worsening shortness of breath, and receiving an annual flu shot are all critical for managing symptoms, preventing exacerbations, and avoiding complications. Moderate intensity exercise might be too much for some clients, and fluid intake is often restricted, not increased, for heart failure patients. For example, a sudden weight gain could indicate the heart is struggling to pump effectively, leading to fluid backup in the body. Remind clients that self-monitoring and adherence to restrictions are their best defense against heart failure flare-ups. Question 8. The nurse is preparing to administer an opioid analgesic to a client reporting severe pain. Which assessments are essential for the nurse to perform before administration? Select all that apply. A. Client's last bowel movement. B. Current pain level using a pain scale. C. Client's respiratory rate and depth. D. Client's level of consciousness. E. Client's blood pressure and heart rate. F. Client's allergies to medications. Answer. Current pain level using a pain scale, client's respiratory rate and depth, client's level of consciousness, client's allergies to medications. This question focuses on the essential assessments before administering an opioid analgesic. The keyword essential highlights crucial safety checks. Assessing the client's current pain level ensures the medication is needed and provides a baseline for effectiveness. Checking respiratory rate and depth and level of consciousness is vital due to the risk of respiratory depression and sedation, which are common opioid side effects. Verifying allergies is a fundamental safety practice to prevent adverse reactions. While the last bowel movement is important for monitoring opioid-induced constipation, and blood pressure/heart rate can be affected, these are not as immediately critical for pre-administration safety as respiratory status and consciousness. For instance, administering an opioid to a client with a respiratory rate of 8 breaths per minute could lead to life-threatening respiratory arrest. Always prioritize ABCs, airway, breathing, circulation, and safety first. Question 9. A client is receiving total parenteral nutrition, TPN, via a central venous catheter. Which nursing interventions are appropriate for this client? Select all that apply. A. Monitor blood glucose levels every 4 to 6 hours. B. Change the TPN tubing every 72 hours. C. Administer insulin subcutaneously as ordered based on blood glucose. D. Use an infusion pump for continuous TPN administration. E. Flush the central line with saline after stopping TPN for a short period. F. Monitor the client's weight daily. Answer. Monitor blood glucose levels every 4 to 6 hours, administer insulin subcutaneously as ordered based on blood glucose, use an infusion pump for continuous TPN administration, monitor the client's weight daily. This question addresses the appropriate nursing care for a client receiving total parenteral nutrition, TPN, through a central line. Appropriate nursing interventions points to actions necessary for safe and effective TPN management. Monitoring blood glucose frequently is crucial due to the high dextrose content, and administering insulin as needed helps manage hyperglycemia. TPN must always be administered via an infusion pump to ensure a precise, consistent rate, and daily weight monitoring helps assess fluid balance and nutritional effectiveness. TPN tubing should be changed every 24 hours with each new bag to prevent infection, and central lines should not be routinely flushed with saline if TPN is stopped. A different solution, e.g., D10W, might be infused to prevent hypoglycemia if TPN is interrupted. For example, a client receiving TPN could quickly develop hyperglycemia if blood glucose is not monitored and managed, leading to osmotic diuresis and dehydration. Always remember strict glucose control and infection prevention with TPN. Question 10. The nurse is caring for a client diagnosed with Clostridium difficile, C. difficile, infection. Which infection control measures are essential for the nurse to implement? Select all that apply. A. Place the client in a private room. B. Wear a gown and gloves for all client interactions. C. Use an alcohol-based hand sanitizer after removing gloves. D. Clean contaminated surfaces with a bleach-based solution. E. Dedicate non-critical equipment, e.g., stethoscope, blood pressure cuff, to the client. F. Instruct visitors to wear masks when entering the room. Answer. Place the client in a private room, wear a gown and gloves for all client interactions, clean contaminated surfaces with a bleach-based solution, dedicate non-critical equipment, e.g., stethoscope, blood pressure cuff, to the client. This question tests knowledge of infection control for C. difficile, which requires specific precautions. The phrase essential for the nurse to implement emphasizes mandatory practices. Placing the client in a private room and using contact precautions, gown and gloves, for all interactions are fundamental to prevent spread. Importantly, C. Difficile spores are resistant to alcohol-based hand sanitizers, so soap and water must be used for hand hygiene. Cleaning surfaces with a bleach-based solution is necessary because it is sporicidal, and dedicating equipment to the client minimizes cross-contamination. Visitors generally do not need masks unless other airborne precautions are indicated. For example, scrubbing hands thoroughly with soap and water is the single most effective way to remove C. difficile spores after leaving the client's room. Always remember that C. difficile requires vigorous contact precautions and specific environmental cleaning. Question 11. A nurse is providing education to a pregnant client about potential signs of preterm labor. Which symptoms should the nurse instruct the client to report immediately? Select all that apply. A. Regular uterine contractions, even if painless. B. Increased vaginal discharge that is watery or bloody. C. Low, dull backache. D. Lightning, where the baby drops lower in the pelvis. E. Pelvic pressure or feeling that the baby is pushing down. F. Swelling in the hands and feet. Answer. Regular uterine contractions, even if painless, increased vaginal discharge that is watery or bloody, low, dull backache, pelvic pressure or feeling that the baby is pushing down. This question focuses on recognizing signs of preterm labor, a critical aspect of prenatal education. The keywords report immediately highlight the urgency of these symptoms. Regular contractions, even if painless, increased watery or bloody vaginal discharge, persistent low backache, and pelvic pressure or a pushing down sensation are all potential indicators of preterm labor and warrant immediate medical evaluation. Lightning is a normal sign of impending term labor, not preterm, and swelling in the hands and feet can be a normal pregnancy discomfort or a sign of preeclampsia, but not directly preterm labor. For example, a client who notices more frequent, rhythmic tightenings of the uterus, even if mild, should contact her provider right away to assess for cervical changes. Emphasize that early detection is key to intervening in preterm labor. Question 12. The nurse is assessing a client with hyperkalemia. Which electrocardiogram, ECG, changes would the nurse expect to observe? Select all that apply. A. Peak T waves. B. Prolonged PR interval. C. Flattened T waves. D. ST segment depression. E. Widened QRS complex. F. Shortened QT interval. Answer. Peak T waves, prolonged PR interval, widened QRS complex. This question tests the nurse's ability to recognize ECG changes associated with hyperkalemia. The key phrase hyperkalemia, high potassium, directs the nurse to recall its specific cardiac effects. Peak T waves are often the earliest and most characteristic sign. As potassium levels rise further, the PR interval prolongs, and the QRS complex widens, indicating impaired cardiac conduction. Flattened T waves and ST segment depression are typically associated with hypokalemia, and a shortened QT interval is not a common finding in hyperkalemia. For example, observing tall, narrow, pointed T waves on the ECG should immediately alert the nurse to potential dangerously high potassium levels and the need for prompt intervention. Always remember tall tense, wide and long for hyperkalemia on an ECG. Question 13. A client with a traumatic brain injury is exhibiting signs of increased intracranial pressure, ICP. Which nursing interventions are appropriate for this client? Select all that apply. A. Position the client with the head of the bed elevated 30 to 45 degrees. B. Encourage coughing and deep breathing exercises frequently. C. Maintain a quiet and calm environment. D. Administer stool softeners as prescribed. E. Avoid hip flexion. F. Hyperventilate the client as a routine measure. Answer. Position the client with the head of the bed elevated 30 to 45 degrees. Maintain a quiet and calm environment. Administer stool softeners as prescribed. Avoid hip flexion. This question focuses on appropriate nursing interventions for a client with increased intracranial pressure, ICP. The keywords increased intracranial pressure demand interventions that minimize cerebral edema and promote venous outflow. Elevating the head of the bed to 30 to 45 degrees, maintaining a quiet environment to reduce stimuli, administering stool softeners to prevent straining, which increases ICP, and avoiding hip flexion, which increases intra-abdominal and intrathoracic pressure, impairing cerebral venous outflow, are all crucial. Coughing and deep breathing can increase ICP, and hyperventilating the client is generally avoided unless there's acute herniation, as it can cause cerebral vasoconstriction and ischemia. For example, a client who strains during a bowel movement can experience a dangerous spike in ICP. Always remember to maintain a calm environment and promote cerebral venous drainage. Question 14. A nurse is conducting a postpartum assessment on a client who delivered vaginally 12 hours ago. Which findings should the nurse consider normal? Select all that apply. A. Fundus firm, at the level of the umbilicus, midline. B. Lochia rubra, moderate amount, with small clots. C. Blood pressure 100/60 mmHg, client's baseline 120/80 mmHg. D. Perineum with mild edema and slight bruising. E. White blood cell count, WBC, of 18,000 cells/mm superscript 3. F. Absence of bowel sounds. Answer. Fundus firm, at the level of the umbilicus, midline, lochia rubra, moderate amount, with small clots, perineum with mild edema and slight bruising, white blood cell count, WBC, of 18,000 cells/mm superscript 3. This question tests knowledge of normal postpartum physiological changes after a vaginal delivery. The term normal guides the nurse to select expected findings within the first 24 hours. A firm fundus at the umbilicus, moderate lochia rubra with small clots, mild perineal edema/bruising, and an elevated WBC count, up to 20,000 to 30,000 cells/mm superscript 3, are all typical as the body recovers. A blood pressure of 100/60 mmHg, significantly lower than baseline, could indicate hypovolemia and is not normal, and bowel sounds should be present, though they might be sluggish. For example, the uterus contracting and moving down to the umbilicus, feeling firm, indicates proper involution and reduces the risk of hemorrhage. It's crucial to distinguish normal recovery from potential complications. Question 15. The nurse is providing discharge instructions to a client with a new colostomy. Which information is essential for the nurse to include? Select all that apply. A. Empty the pouch when it is 1/3 to 1/2 full. B. You can resume your normal diet immediately after discharge. C. Report any skin irritation or redness around the stoma. D. Change the ostomy appliance every other day. E. Cleanse the stoma and surrounding skin with mild soap and water. F. Cut the wafer opening to fit snugly around the stoma. Answer. Empty the pouch when it is 1/3 to 1/2 full. Report any skin irritation or redness around the stoma. Cleanse the stoma and surrounding skin with mild soap and water. Cut the wafer opening to fit snugly around the stoma. This question focuses on essential discharge instructions for a client with a new colostomy. Essential information indicates crucial teaching points for proper self-care and complication prevention. Emptying the pouch when 1/3 to 1/2 full prevents leakage and weight-related detachment. Reporting skin irritation is vital for preventing skin breakdown. Cleansing the stoma with mild soap and water helps maintain hygiene, and cutting the wafer snugly around the stoma protects the peristomal skin from effluent. Clients should gradually reintroduce foods, not resume a normal diet immediately, and the appliance should be changed every 3 to 7 days, not every other day, unless leakage occurs. For example, ensuring the wafer fits precisely around the stoma prevents digestive enzymes from contacting and irritating the skin, which can cause breakdown. Always emphasize skin integrity and proper pouch management. Question 16. A nurse is assessing a client in the emergency department who reports sudden, severe chest pain. Which findings are indicative of a myocardial infarction, MI? Select all that apply. A. Substernal chest pain radiating to the left arm or jaw. B. Pain relieved by rest and nitroglycerin. C. Nausea and vomiting. D. Diaphoresis. E. S3 heart sound. Ef. Elevated troponin levels. Answer. Substernal chest pain radiating to the left arm or jaw, nausea and vomiting, diaphoresis, elevated troponin levels. This question asks for signs indicative of a myocardial infarction, MI. The phrase indicative of a myocardial infarction directs the nurse to recognize classic and diagnostic signs. Substernal chest pain radiating to the left arm or jaw, nausea and vomiting, diaphoresis, sweating, and elevated troponin levels are all strong indicators of an MI. Pain relieved by rest and nitroglycerin is characteristic of angina, not MI. An S3 heart sound is often associated with heart failure, not typically an acute MI presentation. For example, a client complaining of crushing chest pain along with cold sweats and an upset stomach should immediately raise suspicion for a heart attack. Remember, prompt recognition of MI symptoms and diagnostic markers is critical for timely intervention. Question 17. The nurse is caring for a client with a peripherally inserted central catheter, PIC. Which actions are appropriate for PICC line management? Select all that apply. A. Flush the PICC line with normal saline before and after medication administration. B. Perform a dressing change every 24 hours. C. Assess the insertion site for signs of infection, redness, swelling, warmth. D. Use a 10 ml syringe or larger for flushing. E. Obtain blood pressure measurements on the arm with the PICC line. F. Secure the line to prevent kinking or dislodgement. Answer. Flush the PICC line with normal saline before and after medication administration. Assess the insertion site for signs of infection, redness, swelling, warmth. Use a 10 ml syringe or larger for flushing. Secure the line to prevent kinking or dislodgement. This question tests appropriate nursing actions for managing a PICC line. The word appropriate highlights correct practices for maintaining catheter patency and preventing complications. Flushing with normal saline before and after medications, assessing the insertion site for infection, using a 10 ml or larger syringe to avoid excessive pressure, and securing the line are all essential for safe and effective PICC care. Dressing changes are typically performed weekly or when soiled, not daily. Blood pressure should never be taken on the arm with a PICC line to prevent vein compression and damage. For example, using a smaller syringe creates higher pressure and could damage the catheter, so always choose a 10 ml or larger. Always prioritize preventing infection and maintaining catheter integrity. Question 18. A pediatric nurse is teaching parents about measures to prevent sudden infant death syndrome, SIDS. Which instructions should the nurse include? Select all that apply. A. Place the infant to sleep on their back. B. Ensure the infant sleeps on a firm sleep surface. C. Use soft bedding, such as blankets and bumper pads, in the crib. D. Share a bed with the infant to facilitate breastfeeding. E. Avoid overheating the infant during sleep. F. Offer a pacifier during naps and bedtime. Answer. Place the infant to sleep on their back. Ensure the infant sleeps on a firm sleep surface. Avoid overheating the infant during sleep. Offer a pacifier during naps and bedtime. This question assesses knowledge of evidence-based practices to prevent sudden infant death syndrome, SIDS. The instructions to prevent SIDS require the nurse to identify safe sleep practices. Placing the infant on their back, using a firm sleep surface, avoiding overheating, and offering a pacifier during sleep are all recommended by the American Academy of Pediatrics to reduce SIDS risk. Soft bedding, blankets, bumper pads, and bed sharing with the infant are significant risk factors and should be avoided. For instance, putting an infant to sleep on their stomach increases the risk of rebreathing carbon dioxide, which can contribute to SIDS. Always stress the back to sleep, alone, in a crib, on a firm surface, no loose bedding. Message. Question 19. The nurse is caring for a client with diverticulitis experiencing an acute exacerbation. Which dietary modifications would the nurse anticipate for this client? Select all that apply. A. High-fiber diet. B. Low-fiber diet. C. Clear liquid diet. D. NPO, nothing by mouth. E. Avoidance of nuts and seeds. F. Introduction of whole grains. Answer. Low-fiber diet, clear liquid diet, NPO, nothing by mouth, avoidance of nuts and seeds. This question focuses on dietary management during an acute exacerbation of diverticulitis. The keywords acute exacerbation indicate inflammation and potential infection, necessitating bowel rest. Therefore, a clear liquid diet or NPO is often prescribed initially to rest the bowel. A low-fiber diet is recommended during recovery from an acute flare-up, and avoiding nuts and seeds is traditionally advised. Though evidence is debated, it is still a common recommendation. A high-fiber diet and whole grains are beneficial for preventing diverticulitis and during periods of remission, but are contraindicated during an acute flare-up as they can irritate the inflamed diverticula. For example, giving a client with acute diverticulitis a high-fiber salad would worsen their symptoms and inflammation. Always remember to rest the bowel during an acute flare-up of diverticulitis. Question 20. A nurse is assessing a client with Cushing's syndrome. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Truncal obesity with thin extremities. B. Moon face. C. Buffalo hump. D. Hypoglycemia. E. Hypotension. F. Hirsutism. Answer. Truncal obesity with thin extremities, moon face, buffalo hump, hirsutism. This question assesses knowledge of the characteristic clinical manifestations of Cushing's syndrome, caused by excessive cortisol. The term Cushing's syndrome directs the nurse to recall the distinctive physical changes and metabolic effects. Truncal obesity with thin extremities, moon face, buffalo hump, fat pad between shoulders, and hirsutism, excessive hair growth in women, are all classic signs due to altered fat distribution and androgen excess. Hyperglycemia, not hypoglycemia, and hypertension, not hypotension, are also common findings due to cortisol's effects on glucose and fluid balance. For instance, a client exhibiting a rounded face and a prominent fatty pad on their upper back strongly indicates the presence of Cushing's syndrome. Always associate these specific physical findings with cortisol excess. Question 21. The nurse is preparing a client for a colonoscopy. Which instructions should the nurse include in the client's teaching plan? Select all that apply. A. You will need to be NPO for at least 8 hours before the procedure. B. You will need to consume a clear liquid diet for 24 to 48 hours before the procedure. C. Take your prescribed bowel preparation solution as directed. D. You will be given general anesthesia for the procedure. E. Expect to experience some abdominal cramping during the procedure. F. Arrange for someone to drive you home after the procedure. Answer. You will need to consume a clear liquid diet for 24 to 48 hours before the procedure. Take your prescribed bowel preparation solution as directed. Arrange for someone to drive you home after the procedure. This question focuses on essential pre-procedure education for a client undergoing a colonoscopy. The instructions that should the nurse include relate to client safety and adequate preparation. Consuming a clear liquid diet and taking bowel prep as directed are crucial for cleansing the bowel, allowing for clear visualization. Arranging for a driver is essential because clients receive conscious sedation, which impairs their ability to drive. While NPO is required, it's typically for a shorter period, e.g., 4 to 6 hours, for sedation, not 8 hours, and general anesthesia is not typically used for a routine colonoscopy. Conscious sedation is more common. Abdominal cramping is more common after the procedure from air insufflation, not usually during. For example, inadequate bowel preparation can lead to rescheduling the procedure because the physician cannot visualize the colon walls effectively. Emphasize that thorough preparation is key to a successful colonoscopy. Question 22. A client is receiving a continuous intravenous infusion of heparin. Which laboratory value is most critical for the nurse to monitor? Select all that apply. A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. International Normalized Ratio, INR. D. Platelet count. E. Hemoglobin and hematocrit. F. Liver function tests, LFTs. Answer. Activated partial thromboplastin time, APTT, platelet count, hemoglobin and hematocrit. This question focuses on critical laboratory monitoring for a client on a continuous heparin infusion. The keyword most critical emphasizes the direct indicators of heparin's therapeutic effect and major side effects. The activated partial thromboplastin time, APTT, directly monitors the therapeutic effect of unfractionated heparin. Platelet count is critical to monitor for heparin-induced thrombocytopenia, HIT, a serious adverse effect. Hemoglobin and hematocrit are essential for monitoring for potential bleeding, a major complication of any anticoagulant. PT and INR are used to monitor warfarin, not heparin, and while liver function tests may be part of a general workup, they are not specific for heparin monitoring. For example, a rising APTT indicates the heparin is therapeutically thinning the blood, but if it gets too high, the client is at risk for hemorrhage. Always prioritize APTT for efficacy and platelet count /H and H for safety with heparin. Question 23. The nurse is caring for a client with a history of seizures who is prescribed phenytoin. Which teachings should the nurse reinforce with the client and family? Select all that apply. A. You should take this medication with meals to reduce gastrointestinal upset. B. It's important to maintain good oral hygiene, including regular dental checkups. C. If you miss a dose, you can double the next dose to catch up. D. Avoid consuming alcohol while taking this medication. E. Report any skin rash or unusual bruising immediately. F. Expect your urine to turn a harmless orange-red color. Answer: You should take this medication with meals to reduce gastrointestinal upset. It's important to maintain good oral hygiene, including regular dental checkups. Avoid consuming alcohol while taking this medication. Report any skin rash or unusual bruising immediately. This question tests essential client education for phenytoin, an anticonvulsant. The phrase "teachings should the nurse reinforce" requires identifying critical points for safe and effective medication use. Taking phenytoin with meals helps reduce GI upset. Maintaining good oral hygiene is crucial due to the risk of gingival hyperplasia, gum overgrowth. Avoiding alcohol prevents central nervous system depression, and reporting skin rash immediately is vital due to the risk of severe skin reactions like Stevens-Johnson syndrome, while unusual bruising could indicate bone marrow suppression. Missing a dose should not be compensated by doubling the next dose. Orange-red urine is a common side effect of rifampin or phenazopyridine, not phenytoin. For example, consistently brushing and flossing can help mitigate the gum overgrowth associated with long-term phenytoin use. Always emphasize consistent dosing, recognizing side effects, and strict oral hygiene. Question 24. A nurse is providing care for a client who underwent a thyroidectomy and is at risk for hypocalcemia. Which clinical manifestations would alert the nurse to potential hypocalcemia? Select all that apply. A. Muscle twitching and spasms. B. Positive Chvostek's sign. C. Bradycardia. D. Hyperactive deep tendon reflexes. E. Tingling and numbness around the mouth and fingertips. F. Warm, flushed skin. Answer: Muscle twitching and spasms, positive Chvostek's sign, hyperactive deep tendon reflexes, tingling and numbness around the mouth and fingertips. This question focuses on recognizing the signs of hypocalcemia, a common complication after thyroidectomy due to potential parathyroid gland damage. The keywords hypocalcemia and alert the nurse direct the nurse to identify symptoms of low calcium. Muscle twitching and spasms, a positive Chvostek's sign, facial twitching with facial nerve tap, hyperactive deep tendon reflexes, and tingling/numbness, paresthesias, around the mouth and fingertips are all classic manifestations of neuromuscular excitability due to low calcium. Bradycardia and warm, flushed skin are not typical signs. Tachycardia and cool, clammy skin or normal skin are more likely in severe cases. For example, gently tapping the client's cheek and observing a twitch around the mouth would be a clear indicator of hypocalcemia. Always remember that cats go numb, convulsions, arrhythmias, tetany, spasms, numbness, helps recall hypocalcemia symptoms. Question 25. The nurse is preparing to administer a blood transfusion. Which actions are essential before initiating the transfusion? Select all that apply. A. Verify client identity with another licensed nurse. B. Check the blood product against the physician's order and client's armband. C. Obtain baseline vital signs. D. Prime the 4-tubing with dextrose 5% in water, D5W. E. Educate the client about signs of a transfusion reaction. F. Administer a prophylactic antihistamine to prevent reactions. Answer: Verify client identity with another licensed nurse. Check the blood product against the physician's order and client's armband. Obtain baseline vital signs. Educate the client about signs of a transfusion reaction. This question addresses the essential safety steps before initiating a blood transfusion. The term essential highlights critical measures to prevent errors and ensure client safety. Verifying client identity with another licensed nurse, meticulously checking the blood product information against the physician's order and client's armband, obtaining baseline vital signs, and educating the client about transfusion reaction signs are all non-negotiable steps. For tubing must be primed with normal saline, not D5W, as D5W can cause hemolysis. Prophylactic antihistamines are generally not given routinely unless there's a history of mild reactions and specifically ordered. For instance, a double check of client ID and blood product against the order is the most crucial step to prevent a fatal ABO incompatibility reaction. Always prioritize verification, client education, and proper force solution. Question 26. A client presents to the emergency department with symptoms of an opioid overdose. Which assessment findings would the nurse anticipate? Select all that apply. A. Pinpoint pupils. B. Hypertension. C. Bradypnea. D. Hyperactivity. E. Constipation. F. Decreased level of consciousness. Answer. Pinpoint pupils, bradypnea, decreased level of consciousness. This question tests the nurse's ability to recognize the signs of an opioid overdose. The phrase opioid overdose directs the nurse to recall the characteristic triad of symptoms. Pinpoint pupils, bradypnea, slowed breathing, and a decreased level of consciousness, ranging from somnolence to coma, are the classic signs. Hypertension and hyperactivity are not typical, hypotension and hyporeflexia are more common. While chronic opioid use can cause constipation, it's not an acute overdose symptom. For example, finding a client with very small pupils, breathing only 6 times per minute, and unresponsive to verbal stimuli immediately points to an opioid overdose requiring naloxone administration. Always remember the triad: pinpoint pupils, respiratory depression, and decreased consciousness. Question 27. The nurse is caring for a client with bacterial meningitis. Which interventions are appropriate for this client? Select all that apply. A. Place the client in a private room with contact precautions. B. Administer antibiotics as prescribed without delay. C. Keep the client's room brightly lit to facilitate neurological assessment. D. Monitor for signs of increased intracranial pressure, ICP. E. Encourage frequent ambulation to prevent complications. F. Provide a quiet, dimly lit environment. Answer. Administer antibiotics as prescribed without delay, monitor for signs of increased intracranial pressure, ICP, provide a quiet, dimly lit environment. This question focuses on appropriate nursing interventions for a client with bacterial meningitis. Administering antibiotics promptly is critical to combat the infection. Monitoring for increased ICP is essential due to inflammation and potential cerebral edema. Providing a quiet, dimly lit environment helps reduce sensory stimulation, which can exacerbate headaches and photophobia often associated with meningitis. Depending on the specific pathogen, droplet precautions, not contact, are usually indicated in a private room, not always contact. Bright lights would worsen photophobia, and frequent ambulation is typically contraindicated due to severe headache, nuchal rigidity, and risk of falls, especially if ICP is elevated. For example, delaying antibiotics even by a few hours in bacterial meningitis can significantly worsen outcomes and increase mortality. Always prioritize early antibiotic administration, ICP monitoring, and a comfortable, low-stimuli environment. Question 28. A nurse is reviewing the medication list for an elderly client admitted with dehydration. Which medications increase the risk of dehydration and should be noted? Select all that apply. A. Furosemide. B. Lisinopril. C. Diphenhydramine. D. Metoprolol. E. Lactulose. F. Digoxin. Answer. Furosemide, lactulose. This question identifies medications that contribute to dehydration, especially in vulnerable populations like the elderly. The clue increase the risk of dehydration points to drugs that promote fluid loss. Furosemide, a loop diuretic, directly causes increased urine output and fluid excretion. Lactulose, an osmotic laxative, draws water into the colon, leading to increased stool water content and potential dehydration. Lisinopril, an ACE inhibitor, and metoprolol, a beta blocker, are antihypertensives that don't directly cause dehydration. Diphenhydramine, an antihistamine, can cause anticholinergic side effects like dry mouth but not significant fluid loss. Digoxin is a cardiac glycoside with no direct dehydrating effect. For example, an elderly client taking furosemide for heart failure is at high risk for dehydration if fluid intake is not maintained or if they have limited access to fluids. Always be aware of diuretics and laxatives as potential culprits for dehydration. Question 29. The nurse is caring for a client receiving chemotherapy who is experiencing neutropenia. Which interventions are essential for this client? Select all that apply. A. Place the client in a private room. B. Encourage frequent ambulation in the hallway. C. Provide a low-bacteria diet, e.g., no fresh fruits or vegetables. D. Use strict hand hygiene before and after client contact. E. Monitor temperature every 4 hours. F. Administer acetaminophen for fever greater than 100 for degree F, 38 degree C. Answer. Place the client in a private room, provide a low-bacteria diet, e.g., no fresh fruits or vegetables, use strict hand hygiene before and after client contact, monitor temperature every 4 hours. This question addresses essential nursing interventions for a client with neutropenia, a condition of low white blood cell count that increases infection risk. Essential indicates critical actions to prevent infection. Placing the client in a private room, providing a low-bacteria diet, also known as a neutropenic or prophylactic diet, using strict hand hygiene, and monitoring temperature frequently, fever is often the first sign of infection, are all crucial for protection. Frequent ambulation in a public hallway increases exposure to pathogens. Administering acetaminophen for fever can mask a worsening infection. Instead, the fever needs to be investigated and treated aggressively with antibiotics, not just symptomatically. For example, ensuring all visitors and staff meticulously wash their hands before entering the room is a simple yet profoundly effective way to prevent infection in a neutropenic client. Always prioritize infection prevention in neutropenic clients. Question 30. A client with chronic kidney disease, CKD, is discussing dietary restrictions with the nurse. Which foods should the nurse advise the client to limit? Select all that apply. A. Bananas. B. Whole grain bread. C. Canned soups. D. Apples. E. Processed meats, e.g., bacon, sausage. F. Milk. Answer. Bananas, canned soups, processed meats, e.g., bacon, sausage, milk. This question tests knowledge of dietary restrictions for clients with chronic kidney disease, CKD. The phrase advise the client to limit points to foods high in substances that accumulate in CKD. Bananas are high in potassium. Canned soups and processed meats are often very high in sodium and phosphorus. Milk is high in phosphorus and potassium. Apples are generally safe as they are lower in potassium. Whole grain bread is generally limited due to phosphorus content, but can be managed in moderation depending on the CKD stage. In general, CKD diets restrict potassium, sodium, and phosphorus to prevent complications. For example, a client who consumes a banana, a bowl of canned soup, and a glass of milk in one day would significantly exceed their potassium and phosphorus limits, potentially leading to dangerous electrolyte imbalances. Always consider potassium, sodium, and phosphorus restrictions in CKD. Question 31. The nurse is preparing to insert an indwelling urinary catheter into a female client. Which steps are appropriate to ensure sterile technique and client comfort? Select all that apply. A. Position the client in a supine position with knees bent and hips externally rotated. B. Cleanse the perineum with antiseptic solution using a back-to-front motion. C. Inflate the balloon fully with the designated amount of sterile water once urine return is observed. D. Lubricate the catheter tip generously with a water-soluble lubricant. E. Don sterile gloves after opening the sterile catheter kit. F. Secure the catheter tubing to the inner thigh. Answer. Position the client in a supine position with knees bent and hips externally rotated. Inflate the balloon fully with the designated amount of sterile water once urine return is observed. Lubricate the catheter tip generously with a water-soluble lubricant. Don sterile gloves after opening the sterile catheter kit. Secure the catheter tubing to the inner thigh. This question assesses knowledge of appropriate steps for inserting an indwelling urinary catheter, emphasizing sterile technique and client comfort. Positioning the client appropriately, generously lubricating the catheter, donning sterile gloves, inflating the balloon once urine return is seen, and securing the catheter to the thigh are all critical for successful, sterile, and comfortable insertion. Cleansing the perineum should always be done from front to back, not back to front, to prevent contamination from the anal area. For example, improper lubrication can cause significant discomfort and trauma to the client's urethra during insertion. Always prioritize sterile technique and client comfort in this invasive procedure. Question 32. The nurse is caring for a client diagnosed with deep vein thrombosis, DVT. Which nursing interventions are appropriate for this client? Select all that apply. A. Encourage prolonged sitting or standing. B. Apply warm, moist compresses to the affected extremity. C. Elevate the affected extremity above heart level. D. Administer anticoagulant medication as prescribed. E. Encourage passive range of motion to the affected leg. F. Monitor for signs of pulmonary embolism, e.g., sudden shortness of breath, chest pain. Answer. Apply warm, moist compresses to the affected extremity, elevate the affected extremity above heart level, administer anticoagulant medication as prescribed, monitor for signs of pulmonary embolism, e.g., sudden shortness of breath, chest pain. This question focuses on appropriate nursing interventions for a client with deep vein thrombosis, DVT. The word appropriate directs the nurse to select interventions that alleviate symptoms, prevent further clot formation, and monitor for complications. Applying warm, moist compresses helps reduce discomfort, elevating the affected extremity promotes venous return, administering anticoagulants is crucial to prevent clot enlargement and embolization, and monitoring for signs of pulmonary embolism, PE, is vital due to the high risk. Prolonged sitting/standing would worsen venous stasis, and passive range of motion is generally contraindicated as it could dislodge the clot. For instance, elevating the leg helps reduce swelling and pain by promoting fluid drainage back to the heart. Always prioritize preventing PE and reducing symptoms with DVT. Question 33. A nurse is educating parents about signs of dehydration in an infant. Which findings should the nurse include as indicators of dehydration? Select all that apply. A. Dry mucous membranes. B. Sunken fontanelle. C. Increased urine output. D. Absence of tears when crying. E. Bradycardia. Eve. Increased capillary refill time. Answer. Dry mucous membranes, sunken fontanelle, absence of tears when crying, increased capillary refill time. This question assesses knowledge of the clinical signs of dehydration in an infant. The phrase indicators of dehydration requires recognizing the physiological responses to fluid volume deficit. Dry mucous membranes, a sunken fontanelle, absence of tears when crying, and increased capillary refill time are all classic signs of dehydration. Increased urine output is a sign of adequate hydration, not dehydration. Urine output would be decreased D. Bradycardia is not typical. Tachycardia is more common as the heart attempts to compensate for decreased circulating volume. For example, gently pressing on the infant's nail bed and noting it takes longer than 2 seconds for the color to return suggests poor perfusion due to dehydration. Always remember that signs of dehydration reflect a lack of fluid in the body's tissues and circulation. Question 34. The nurse is caring for a client with a C5 spinal cord injury. Which potential complications should the nurse actively monitor for in this client? Select all that apply. A. Autonomic dysreflexia. B. Deep vein thrombosis, DVT. C. Orthostatic hypotension. D. Hyperglycemia. E. Pressure injuries. Eve. Respiratory compromise. Answer. Autonomic dysreflexia, deep vein thrombosis, DVT, orthostatic hypotension, pressure injuries, respiratory compromise. This question addresses the major potential complications following a C5 spinal cord injury. Potential complications requires recognizing the systemic effects of high-level spinal cord damage. Autonomic dysreflexia, a sudden, dangerous rise in blood pressure, DVT, due to immobility, orthostatic hypotension, impaired vascular regulation, pressure injuries, due to immobility and sensory loss, and respiratory compromise, impaired diaphragm/intercostal muscle function, are all significant risks. Hyperglycemia is not a direct complication of spinal cord injury itself, though it could be a comorbid condition. For example, a full bladder or bowel impaction can trigger autonomic dysreflexia, leading to a severe hypertensive crisis that requires immediate intervention. Always anticipate and proactively manage these life-threatening complications in clients with high spinal cord injuries. Question 35. A nurse is preparing a client for discharge following a total knee arthroplasty. Which statements indicate readiness for discharge? Select all that apply. A. Client demonstrates correct use of crutches for ambulation. B. Client verbalizes understanding of pain medication regimen. C. Client states they will attend outpatient physical therapy as scheduled. D. Client reports sharp, shooting pain in the surgical leg. E. Client's incision site shows mild redness and warmth. Eve. Client can perform activities of daily living, ADLs, with minimal assistance. Answer. Client demonstrates correct use of crutches for ambulation. Client verbalizes understanding of pain medication regimen. Client states they will attend outpatient physical therapy as scheduled. Client can perform activities of daily living, ADLs, with minimal assistance. This question assesses a client's readiness for discharge after total knee arthroplasty. The phrase readiness for discharge implies the client can safely and effectively manage their recovery at home. Demonstrating correct use of assistive devices, understanding medication regimens, committing to follow-up physical therapy, and being able to perform ADLs with minimal assistance are all crucial for safe discharge. Sharp, shooting pain could indicate nerve damage, and mild redness and warmth at the incision site could signal an infection, both of which are concerning findings that need further assessment before discharge. For instance, a client who can walk safely to the bathroom using their crutches and understands when to take their pain pills is well prepared for home recovery. Always ensure clients have the knowledge and functional ability to care for themselves before sending them home.